It's Friday morning, and you know what that means. It's time for the About Mansfield Consumer Advice Series, and welcome. Today, because it's 9 in the morning, we're talking about your health, and specifically, as part of the series that we've been doing here on About Mansfield, we're talking about migraines. And with us is Mansfield's foremost expert, that's what I call him, on migraines, and that'd be Dr. Joseph Adams. Welcome back to About Mansfield.
Thanks for having me, Steve.
Absolutely. Dr. Joseph Adams from Calibration Chiropractic and Functional Health right here in Mansfield, Texas. Now, Dr. Joe, what I want to talk to you about, especially because we're now getting into the nitty-gritty of migraines, let's talk about the eyes and how that plays into migraines. And so, how important is it to get your eyes checked in regards to migraines?
That's a really good question, Steve, because I think a lot of people have been down that road who have head pain of any type. A lot of people will think, very rightly so, that it's a good idea to go get their eyes checked if they have, headaches. And that's one of the things that I wanted to bring up. And it is a good idea to get your eyes checked. But when you get your eyes checked, they may not be necessarily looking at one of the more important factors. And so that's one of the things that I'd like to discuss today.
All right. And you were mentioning before we went on the air that each eye works individually, and thinking in layman's terms of thinking of a pair of binoculars, that each lens has its own focusing device, and the eye is very similar to that, or both eyes are similar to that. And so again, if you're experiencing headaches, if you're experiencing migraines, uh, again, the role of getting your eyes checked, and that can be done through your office or an ophthalmologist.
Yeah, so there's a difference between what we'll look at. So obviously, I'm not an ophthalmologist or an optometrist, and my goal is not necessarily to look at how good your vision is, like what you see and what your retina does and things like that. That is not necessarily what I look at, but you do need to see an optometrist regardless, to make sure that the things that they look at with vision are addressed. Now, the other component of vision that people don't really ever think about, and it's a newer thing that really only neuro optometrists look at, and that is eye tracking. So, just like you were talking about, you've got two different eyes, you've got 12 different eye muscles, you have six on each, and at all times, your brain is controlling those six muscles on each eye, 12 muscles total, and keeping them perfectly aligned. So, can you imagine how complex that is for your brain to do, to keep 12 muscles completely in sync on two different sides of the head so that you can have perfect vision, and not only have perfect vision, but perfect vision when you move, right? And see everything accordingly. And so what we do in our office is we have a infrared camera system called Right Eye, and it can lock on to your pupils with infrared cameras and measure how effective your eyes work together when they move. And that's what we look at as dynamic vision.
Okay, and so something as what's commonly known as lazy eye, could that trigger a migraine?
So that's a really good one to talk about. So if you have, let's say, one eye that doesn't really follow the other one or doesn't line up the other one, that can give you enough neurologic stress to trigger a migraine disorder. So I don't want to get in a situation where I'm saying that everybody's got a lazy eye could have a migraine, because that's obviously not the truth.
Yeah.
But if you are a migrainer, and we know that you have primarily dysfunction in your brain stem, which is the part of your brain that sits in the upper part of the neck,
Hmm.
all the neurons for your eye control sit there in that brain stem, and that's the dysfunctional area. So if you have abnormal eye movements, you're most likely going to be more likely to trigger migraines if you're a migrainer.
Tell me again about the process that your office does with the doing the eye check.
Yeah, so what we'll do in the office is just a simple bedside test. I'll just sit there with the patient, have them just sit still, don't move their head, and I'll see, from my point of view, with my own eyes, if I think their eyes track accordingly, right, appropriately. And sometimes I can see it. I'll see somebody pursuing my finger, and their eye, instead of being really smooth like this, they'll do a little twitch, a little flutter, and they're like, "Ooh, kind of got a little dizzy there," or "Oh, I got
Mm.
double vision," or "Oh, I got a all of a sudden my head kind of hurts a little bit from doing that." And that's what I'm looking for in a bedside screening. Now, here's the interesting thing: is that these eye movements are so precise and so intricate that sometimes I can't see it.
Yeah.
And so that's why we use the camera system, because there are times when I look at somebody and I'm like, man, I really think you probably have this dysfunction because of your history, but I can't see it with my own eyes because my own eyes can only pick up so much information, right? And so that's where the technology comes in. And so this technology will look at how well you target and stay on a target like this, which we call uh, targeting, basically, very
Okay.
simple, right?
Okay.
Or fixation would be another good way to think about it. It's like, can you fixate on a target? Just like shooting, right? So we look and see, if people's eyes line up in these bullseyes like they should, or if they're off relative to each other. And then we also look at how well they pursue a target. And then the last one, which is the most complicated, is how well they can go between two targets like this. And all that information gives us the ability to understand where the dysfunction is, not only in their eyes, but also where the dysfunction is in their brain. And that's the coolest part.
Does age play into this? As you get older, do your eyes tend to drift more than if you were younger? And is that another trigger to migraines?
So I would say that there is obviously some decline in how well you see when you age, and a lot of that actually is muscular, and that's more of like in the inside the eyeball. And so, just so we're really clear, I don't really mess with anything on the inside of the eyeball. I'm just talking about those muscles. And so you can obviously get weakness, but for the most part, clinically, and this is not from the research or any thing, but clinically, I don't really see a correlation between, hey, you get older and this becomes a problem. I see more of a correlation if you've had an injury, or if you're a migrainer, or you have some neurological condition. So some of the people that have this are, if you have Parkinson's, MS, if you have had a concussion, if you've had strokes, if you've had mini strokes, I've seen that recently. If you have other like connective tissue disorders, I've seen that as well. And so there's a lot of conditions that can set you up to have abnormal dynamic eye vision. And so that's what we're looking for in the office.
All right. In the couple of minutes that we have left, I want to kind of pivot here for just a second. My wife manages a few people in her office, and one of the employees came to her asking if she could leave work early because she felt a migraine coming on. How and that to me is because I've never experienced a migraine. I always thought that migraines just popped on. How much notice does a migraine give a person before it actually locks them down?
So a true migrainer usually has what we call a period of time before the pain strikes called a prodrome. Okay. And so everybody's prodrome is probably a little different. Some people may get like notification like a couple hours beforehand, maybe a day beforehand. It just kind of depends on their specific disorder, what the prodrome is. And some of those are like, I feel tired. Some are, ooh, my stomach kind of feels off. Some people are like, oh, I'm having some vision difficulties, like maybe their vision gets a little bit smaller. And so if you're very in tune with your body and or been dealing with this for a while, you do usually know when you're going to have a migraine event because this prodrome will alert you. And the interesting thing about it is that's the most important time to intervene. Even if it's pharmaceutically, that's the best time to take your pharmaceutical medication, your abortives, and your preventatives, because they work better in that window before the pain sets in. It's also the best time to use some of our complementary and alternative therapies as well to abort a migraine before it starts.
Mm. Okay. So she wasn't actually going fishing then.
No, no, no,
Yes.
no, no. She's probably actually going to have some serious issues.
Yeah, right. If anyone out there has questions about migraines or calibration, chiropractic, and functional health in general, how can they reach out to Dr. Joseph Adams?
Oh yeah, you can find us anywhere. We're on the web at calibrationmansfield.com. We're on YouTube. We're on Instagram. We're pretty easy to get in touch with, and we always offer a complimentary consultation where you can come in, sit down with us, and see if we can help you.
Dr. Joseph Adams, have a great weekend.
You too, buddy.